You may experience a drop in your blood cell counts, feeling and being sick, hair thinning or hair loss, sore mouth and mouth ulcers, and these are just to name a few. There are also many other medications that are given in combination with chemotherapy and with steroids. These medications are given primarily to have a direct and positive impact on the side effects from the primary medications of chemotherapy and steroids. Physical therapy. Physical therapy can positively affect you in many ways. Some of these include energy conservation, education and awareness, strengthening and conditioning, safety, as well as with alternative means to complete activities of daily living and really everyday functional activities. A good example of some of those activities of daily living or functional activities, things that we would do to help complete those easier would involve the use of adaptive equipment, or learning from you what challenges you have in being able to complete those activities, and then teaching you alternative ways to be able to safely complete those activities, conserving the maximum amount of energy possible. Interventions typically employed by physical therapists include home evaluations, clinical evaluations, education about myeloma and resources available, awareness about how you are feeling, how you are doing, what limitations you have, and most importantly, an individually prescribed exercise and activity program catered especially towards you. Specific benefits with myeloma have been studied within the research realm. I'd like to mention a couple of these studies. Weight-bearing activities. It is well known within the healthcare community that weight-bearing activities, when I say that, I mean activities such as jogging, things that impact your bones, generally have a positive impact on bone density and bone integrity. Now, as we all know, myeloma directly affects and impacts the integrity of these bones. So this is where a skilled clinician can come in and identify alternative weight-bearing activities if that's what your focus is with regards to activity level and exercise. One study recently reported that patients who did not exercise prior to their diagnosis of multiple myeloma were less likely to exercise following their diagnosis of multiple myeloma. And in the study which relates to the first one, people who did exercise, especially in between treatment sessions with chemotherapy and steroid medication administration, those people who had the individually prescribed exercise and activity program reported a significant improvement in their quality of life compared to those patients who did not exercise at all. So the studies are demonstrating scientifically that the benefits are out there for people undergoing treatments for multiple myeloma. Some of the specific benefits related to physical therapy are really very numerous. They can include improving your balance, prevent depression, have you have a feeling of being less fatigued and less nauseous, and especially being better able to complete activities of daily living, normal activities that we take for granted whenever we're feeling well and able. Exercise safety is another important component to physical therapy. Because of the side effects of the medications associated with addressing myeloma, the integrity of the bones are weakened, and other medicinal side effects can negatively impact your ability to safely get around. And you can think of those activities, the parts of your life that are positively impacted, such as the balance and the strength, when talking about the specific things that therapy can do. Now, the American Cancer Society does have some general recommendations about activities and exercises. Avoid public gyms, very public places, a lot of germs. There is an infection risk at these public gymnasiums. Minimize activities that make you fall. It's, so to speak, bad enough to have to deal with the symptoms associated with myeloma, the side effects of the medication. We don't need to add in a third strike, but not to be out a third strike of, say, a bone fracture. Avoid lifting heavy weights. You do not want to put undue stresses on your bones, especially if your bones are particularly fragile. If you're feeling sick, numb, dizzy, find alternative exercises. Find alternative means to complete your exercise routine. A good example is with treadmill activities. If you're feeling a little bit dizzy, do something else like a recumbent bike. Much more safer for you to be in a seated position on a recumbent bike, getting very similar benefits than you would on a treadmill. Now, being able to start a physical therapy program is really quite easy. First and foremost, speak with your primary health care provider, your physician. The two of you will decide on the indication and benefits and need of physical therapy at any given time of your course of dealing with multiple myeloma. Your physician would then write a prescription, a referral to physical therapy. Most insurance plans will cover most, if not all, of everything related to physical therapy. The interventions, the durations, and the frequencies that are identified at the time of evaluation are generally completely covered by insurance, but of course you will need to communicate with your insurance provider directly if you have any questions related to that. And lastly, as I previously mentioned, the frequency, duration, the type of activities that would be prescribed at the time of a physical therapy evaluation will be discussed with the entire healthcare team, communication with the physician, and most importantly with you to make sure that it meets your goals. An interdisciplinary team approach is probably and perhaps the most critical way to approach addressing everything related to multiple myeloma. Talk with your physician. Let your physician know how you're feeling, how you're doing, if you're having difficulties with anything and everything. Something that might be very insignificant to you might be the key in improving your quality of life to other healthcare providers. The skilled clinicians are trained and experienced in being able to hone in on those what you may see as an insignificant change in your status to be able to greatly impact your life. Talk with your therapist, talk with your other allied healthcare professionals, with the rest of the team, the nurses, the dietitians, the clinicians, the therapists, everyone. Be open and candid with what you have to say to them. That honesty is really going to only be beneficial for you. Know your medical status. Know your lab values, the hemoglobin and hematocrit, your white blood cell count. Talk with your physician about the integrity of your bones. Are you at a very high risk for fracture or at a lower risk for fracture? Know your limitations. Know what's easy to do. Know what's hard to do. Don't overdo it, especially during periods of treatment. Speak with your clinicians to make sure that those things that you have difficulty with, and depending on when you have difficulties with those tasks, that we can be able to directly address those. In conclusion, very important to know the pathology of myeloma, how it affects you, where it affects you, why it affects you. Know those medications and those side effects. That's one of the most and hardest things to deal with. Some of them are severe, some of them are easy. The number of medications that you may take first to address the progression of myeloma, then to address the side effects of those primary drugs can be numerous and very complicated to deal with. But there are ways and means to address each and every one of those side effects one way or another. Understand the resources available. A lot of them are here today. Thanks to the Arizona Myeloma Network, there is a wealth of resources specifically for myeloma, as well as to fight cancer as a whole. Numerous resources, and we are here to be your advocates, to be your point of resource. And most importantly, communicate with your healthcare providers. Let them know what's going on. Be open and honest. Keep in mind that you are the key to your success. You are your own best advocate. Don't hesitate to ask questions, to inquire as to why you're receiving what and what the effects were. If you don't take care of yourself, no one else is going to take care of you. Thank you.